Hello everyone, I am Vinod Kumar, working as an assistant professor in Tandai Periyar Government Institute of Technology, Vellore. So now I am going to present a video lecture in the subject therapeutic equipment. The subject code is CBM368. So in that unit 3 is body care equipment. So now we discuss about vacuum therapy unit, so which is present in unit 3. The objective is to enable the students to gain knowledge on the working of therapeutic body care equipments. So vacuum therapy unit is otherwise named as vacuum assisted closure is a novel wound healing technique. So vacuum assisted closure incorporates the use of negative pressure to optimize conditions for wound healing and requires fewer painful dressing changes. Wound healing is the process of repair that follows injury to the skin and other soft tissues. So wounds may result from trauma or from a surgical incision, pressure ulcers, bed sores, and skin ulcers. So standard wound management consists of initial surgical debridement, a rapid and effective technique to remove devitalized tissue, wet to moist gauze dressings which need to change at least twice daily. So these dressings are relatively inexpensive. So mechanism of wound healing. So in this, so three phases of wound healing are present. So in that, number of cell types are involved. So in coagulation process, so platelets is involved, and in inflammatory process, platelets, macrophages, and neutrophils are involved, and in proliferatory process, macrophages, lymphocytes, fibroblasts, epithelial cells, and endothelial cells are involved, and in remodeling process, fibroblasts are involved. So next we discuss about the phases of wound healing. So there are three different phases in the wound healing process. So first one is inflammatory phase. So in inflammatory phase, it starts immediately after injury and lasts for about 3 to 5 days. Blood vessels at the wound site constrict to minimize bleeding, followed by vasodilation to increase blood flow, delivering immune cells and nutrients to the area. Platelets form a clot to stop bleeding and create a professional matrix for cell migration. So inflammatory cells such as neutrophils and macrophages arrive at the wound site to remove debris, bacteria, and damaged tissue. Inflammation can cause redness, swelling, heat, and pain around the wound. So next we discuss about proliferatory phase. So overlaps with the inflammatory phase and typically lasts from day 3 to around 2 weeks post injury. So fibroblasts start producing collagen and other extracellular matrix components which strengthen the wound. New blood vessels from through angiogenesis providing oxygen and nutrients to support tissue growth. So granulation tissue forms consisting of new blood vessels and collagen, filling the wound space. Epithelial cells at the wound edges migrate and divide to cover the wound, so which is named as epithelialism. The wound contracts as myofibroblast, pull the wound edges together, reducing the wound size. So next, finally, we discuss about remodeling phase. So begins around 2 weeks after injury and can last for months or even years. So collagen fibers reorganize and realign, increasing wound strength. The wound's tensile strength improves as collagen matures. So excess collagen is broken down and removed, reducing scar tissue's bulkiness. The wound area becomes less vascular and less noticeable as the scar matures. So this explains the cellular components present in the wound repair. So next, what is the novel concepts in wound healing means? So dry dressing, wet to dry dressing, foam dressing, and then alginate dressing, hydrofiber dressing, transparent film dressing, and hydrogel dressing, finally hydrocolloid dressing. Vacuum assisted closure therapy. So the application of controlled levels of negative pressure accelerates the debridement and promote healing in many different types of wounds. So the optimum level of negative pressure appears to be around 125 mmHg. So negative pressure assists removal of interstitial fluid, decreases localized edema, increases blood flow. So this is a setup for vacuum assisted closure therapy, and mechanism of action in this vacuum assisted closure therapy involves a number of processes. So first one is removal of excess wound fluid. So the negative pressure applied by the vacuum therapy unit helps to remove excess wound fluid. So it is also known as exudate from the wound bed. So excessive exudate can delay wound healing, promote bacterial growth, and inhibit the formation of healthy granulation tissues. By removing the excess fluid, the wound environment becomes more conducive to healing. Next, stimulation of blood flow. So the negative pressure helps to improve blood circulation to the wound area. So increased blood flow brings essential oxygen, nutrients, and immune cells to the wound, supporting tissue repair and regeneration. Adequate oxygenation is crucial for cells involved in the wound healing process. So next one is promotion of tissue granulation. So granulation tissue is the new connective tissue that forms during wound healing. So vacuum therapy enhances the development of granulation tissue by promoting fibroblast activity, collagen production, and the formation of new blood vessels. Granulation tissue is essential for wound closure and provides a scaffold for the growth of new tissue. So next, reduction of edema. So edema is the accumulation of excess fluid in tissues which can occur around a wound due to inflammation. So negative pressure helps reduce edema by promoting fluid movement away from the wound site and improving lymphatic drainage. So next, wound contraction. So the application of negative pressure can lead to wound contraction. So this occurs when myofibroblasts, specialized cells within the wound, contract and pull the wound edges closer together. So wound contraction can reduce the wound size and contribute to wound closure. So next, bacterial control. So controlled negative pressure environment created by vacuum therapy can reduce bacterial load in the wound. The dressing used in negative pressure wound therapy creates a barrier that prevents external contaminants from entering the wound, reducing the risk of infection. So stimulation of cellular activity is vacuum therapy has been shown to stimulate the activity of various cells involved in wound healing, including fibroblasts, endothelial cells. So these cells responses contribute to tissue repair and regeneration. Next, we discuss how the wound healing works. So application of the wound dressing. So a specialized wound dressing often made of foam is placed directly over the wound. The dressing is then covered with a transparent film to create a seal. So connection to the vacuum therapy unit. So a tube connects the wound dressing to the vacuum therapy unit, creating a closed system. So then application of negative pressure. So vacuum therapy unit applies controlled negative pressure to the wound site through the connected tube. So the negative pressure gently removes excess wound fluid and cellular debris, reducing edema and inflammation. So then it promotes the blood flow and tissue growth. So then continued wound monitoring process. A vacuum therapy unit can be set to deliver the appropriate level of negative pressure, and the dressing is changed regularly as part of the wound care regimen. So process of wound healing is monitored over time. So what are all the benefits of vacuum therapy for wound healing is, so accelerated wound healing, then reduced infection risk and improved wound closure, so enhanced patient comfort and versatility, and then reduces the need for frequent dressing changes. So advantages are, so it provides more effective therapy because target subatmospheric pressure is monitored by VAC therapy, and reduced frequency of dressing changes, reduced bacterial cell count, enhanced dermal perfusion, provision of closed moist wound healing environment, and it controls the odor, so reduction in number of surgical procedure. So some of the disadvantages by this VAC therapy is pain and discomfort when suction is applied. So allergies to adhesive drape and a noise of VAC therapy unit are the some of the disadvantages by using this therapy machine. So next, what are the applications by using this vacuum assisted therapy unit? So first one is, vacuum therapy is commonly used on post-operative wounds, including surgical incisions and wounds resulting from procedures like open abdominal surgeries, orthopedic surgeries, and tissue grafts. It helps in reducing the risk of wound complications and promotes faster healing. So second application is diabetic foot ulcers. So diabetic foot ulcers are chronic wounds that are common in individuals with diabetes. Vacuum therapy can be highly beneficial for managing diabetic foot ulcers by promoting granulation tissue formation, removing excess fluid, and reducing the risk of infections. So next is pressure ulcers, also known as bed sores, occur due to prolonged pressure on the skin and underlying tissues. The vacuum therapy aids in wound healing by increasing blood flow, reducing inflammation, and promoting wound contraction. So next is venous leg ulcers. It is a chronic wounds that develop due to venous insufficiency. So vacuum therapy can help in managing these ulcers by promoting the formation of granulation tissue and improving wound drainage. So next important application is traumatic wounds. So vacuum therapy can be used for wounds resulting from accidents, burns, and other traumatic injuries. So it helps create a favorable environment for wound healing and reduces the risk of infection. So vacuum therapy can be applied to infected wounds as it helps to remove wound exudate and infectious material. So reducing bacterial load and promoting a cleaner wound environment. So these are all some of the references so taken for this topic. Thank you.